Hello, everyone, and welcome to the Healthy Talks channel. I'm Emily, and I'm joined by Dr. Steven. The topic of today is, does coffee raise your blood pressure?
It's great to be here, Emily. And this is a big one. I think this question is on the mind of pretty much every adult I know.
Oh, absolutely. I mean, Steven, you know me. That first cup of coffee in the morning is, well, it's non-negotiable for me to be a functioning human.
Right.
But I do get that little pang of guilt sometimes. You know, you have that extra cup and you feel a bit jittery and you start to wonder, is this just energy or is my heart working overtime here?
It's that classic nutritional ping pong match, isn't it? One week an article says coffee is a superfood, the next, it's bad for your heart.
Exactly. It's emotional whiplash.
And patients ask me this all the time. Their blood pressure might be a little high at a checkup, and the first thing they say is, "Doc, do I have to give up my coffee?" They look terrified.
And what do you tell them? Please don't say yes, or we might lose half our audience right now.
Well, the good news is, for most people, the answer is no. But like everything in medicine, it's nuanced. It's not a simple yes or no.
Okay.
We really need to understand what that jolt you feel is actually doing to your cardiovascular system.
Yeah.
Because there's a biological reaction happening.
So let's do that. We should separate the temporary spike from any actual long-term damage. I feel like that's where all the confusion is.
Exactly. We're going to look at the short-term effects, what's happening inside your arteries.
Yeah.
Then there's this fascinating mystery about espresso that really changes how we should think about coffee.
Ooh, I'm intrigued.
And finally, we'll nail down exactly who needs to be careful, because there is a very specific group that should be cautious.
Perfect. So let's start with the basics. I take a sip of coffee. I feel more alert. What is physically happening inside me?
So that caffeine hits your system, and it's a powerful stimulant. We have a couple of strong theories on how it works. The main one involves a hormone called adenosine.
Adenosine. I've heard of that. It's related to sleep, right? It builds up during the day and makes you feel tired.
That's the one. Think of adenosine as the brake pedal for your brain and your blood vessels. It tells them to relax, to widen, so blood can flow easily.
Okay, so it keeps the lanes on the highway wide open?
A perfect analogy.
Hmm.
But caffeine is a bit of an imposter. On a molecular level, it looks almost identical to adenosine. So it's into your system, and it basically steals adenosine's parking spot in all the receptors.
So the real adenosine, the brake pedal, can't do its job.
Exactly. You've effectively blocked the brakes. So instead of staying wide, the blood vessels start to narrow. On top of that, caffeine can also trigger your adrenal glands to release a little adrenaline.
The fight or flight hormone. So we've blocked the brakes and we're tapping the gas pedal at the same time.
Right. Imagine a garden hose with water flowing through it. That's your blood flow.
Okay.
Now, what happens if you put a kink in that hose?
The pressure builds up right behind the kink. It has to work harder to get the water out.
And that's exactly it. Your heart is the pump. The caffeine acts as a vasoconstrictor. It kinks the hose, narrows the vessels, and your heart has to pump harder to push the blood through.
That makes so much sense. So how quickly does this all happen?
It's pretty fast. You'll usually see a spike in blood pressure within about 30 minutes, and it peaks around the 1-hour mark.
And how big of a spike are we talking about? Is it something you'd even notice?
Oh, it can be significant. We're talking a potential rise in the systolic pressure. That's the top number, by as much as 10 points.
10 points. That feels like a lot.
It is. I mean, if your blood pressure is, say, a healthy 115, a jump to 125 is no big deal. But if you're already at 128, that coffee can push you temporarily into the 130s, even close to 140.
So you could go from having controlled blood pressure to technically having stage 1 hypertension just for that morning.
For a few hours, yes. And that's why we always tell people don't drink coffee right before you come in for a blood pressure check. You're just setting yourself up for a bad reading.
Right. But okay, Stephen, what about what about different people? I have a friend who can have an espresso after dinner and sleep like a baby. If I did that, I'd be staring at the ceiling all night.
That's the genetic lottery.
Yeah.
It all comes down to an enzyme in your liver called CYP1A2.
Sounds like a license plate.
It does, but its job is to break down caffeine. Some people are fast metabolizers. Their body clears the caffeine out very quickly.
The espresso at night people.
Exactly.
Yeah.
But others are slow metabolizers. The caffeine hangs around in your system much longer, causing those side effects, the jitters, the anxiety, the insomnia.
Okay, that makes sense. But this brings me to that study you mentioned, the one that I found so confusing at first, the espresso paradox.
Yes. This is such a great piece of research because it just turns our basic assumptions upside down. We all think caffeine is the active ingredient, coffee is just the water.
Right. A caffeine pill should do the same thing as a cup of coffee with the same amount of caffeine.
That's what you'd think. So researchers got 15 healthy volunteers, some coffee drinkers, some not, and they tested them under 3 conditions.
Okay, what were they?
First, they gave them a triple espresso. Potent stuff. Second, a decaf triple espresso. And third, they gave them pure caffeine, equivalent to the triple shot, through an IV.
Okay, so if I were to guess, the IV caffeine would have the biggest effect because it's going straight into the bloodstream.
That's the logical conclusion. And the decaf should do nothing at all.
Yeah.
But that is not what happened. For the people who were not regular coffee drinkers, the triple espresso shot their blood pressure up by about 13 points.
Okay, that fits the kink in the hose model.
Right. But the pure IV caffeine, it only raised their blood pressure by about 6 points.
Wait, what? Half as much. But the caffeine levels in their blood were the same.
Identical. The coffee itself was twice as powerful as the pure drug.
So there's something else in the coffee that's adding to the effect.
You'd think so. But here's the real kicker. The decaf triple espresso.
You one with basically no caffeine.
That one raised the non-drinker's blood pressure by 12 points.
No! Seriously, 12! Almost the same as the fully caffeinated one.
Almost identical. 12 points for decaf, 13 for regular, both way more than the pure caffeine.
Stephen, I don't understand. What does that even mean? What else is in there?
That is the million-dollar question. It just proves that coffee is this incredibly complex brew. It has hundreds of compounds, oils, acids, polyphenols, and something else in that bean is contributing to this presser effect in people who aren't used to it.
That's wild. We blame everything on caffeine, but it might not even be the main culprit.
Or at least not the only culprit. It's about the entire food matrix, not just one isolated molecule.
But you said something important there.
Yeah.
And people who aren't used to it. That's me. I drink coffee every day. I hope I'm not getting a 13-point spike every morning.
And that brings us to our next point. Tolerance. Your body is an amazing adaptation machine.
Okay.
Emily, if I snuck up behind you and clacked my hands really loudly, you'd jump, right?
I would probably throw my headset across the room, yes.
But if I did it every single morning for a month, eventually you wouldn't even flinch. Your brain learns to expect it. Your arteries do the same thing with caffeine.
So my body's just used to it now.
Pretty much. In that same espresso study, what do you think happened to the habitual coffee drinkers?
I'm guessing they had a much smaller reaction.
They had almost no reaction at all. Negligible. A point or two, maybe. Their body has adapted. It knows the caffeine blockade is coming, so it adjusts. The kink in the hose effect just doesn't happen in the same way.
Okay, that is a huge relief.
And we see this in other studies, too. One looked at young medical students, gave them the standard 80-milligram cup of coffee. As a group, the average rise in blood pressure was tiny, maybe 2 or 3 points. But when they looked closer,
Let me guess. The only ones who reacted were the non-drinkers.
you got it. The spike is really a novice's problem. If you're a daily drinker, your body has most likely built up a tolerance.
So for most of us, our daily habit isn't secretly giving us long-term hypertension.
Correct. For most healthy adults, even those with managed high blood pressure, moderate, regular coffee drinking doesn't appear to cause chronic hypertension.
Moderate is the key word, I'm sure. But let's shift to safety. Is there a line? Is there anyone who really should just stop drinking it?
Yes. There is one specific group where the data is, well, it's pretty stark.
Yeah.
And we're talking about people with severe hypertension.
And what's the definition of severe here?
We're looking at a blood pressure of 160 over 100 or higher.
Okay, that's very high. That's well into the danger zone.
It is. A large study out of Japan followed people for years, and they found that this specific group, the 160 over 100s, drinking 2 or more cups of coffee a day, was linked to doubling the risk of dying from cardiovascular disease.
Doubling. 100% increase. That's a staggering number.
It is a massive risk increase. We're talking heart attacks, strokes. The theory is that if your system is already under that much extreme pressure, adding the vasoconstriction from multiple cups of coffee might just be the thing that pushes it over the edge.
But the strange thing in the notes here was that 1 cup a day was okay.
That's the really interesting part. 1 cup did not increase their risk. 2 or more did. It suggests there's a threshold that, once crossed, dramatically increases the danger for that specific population.
What about green tea? It has caffeine too. Was it the same?
It has less caffeine, maybe 30 to 50 milligrams versus coffee's 80 to 100. But no, the same risk was not found for green tea drinkers, even if they drank multiple cups.
Even in the group with severe hypertension.
Correct.
Why not? Just the lower caffeine.
That's likely part of it. But we also think the high concentration of polyphenols, those powerful antioxidants in green tea, might be protective. They can actually help relax blood vessels.
So the good stuff in the tea might be canceling out the bad stuff from the caffeine.
It's a plausible theory. It seems the overall chemical cocktail in green tea is just more heart-friendly, especially when the system is already under stress.
Okay, so that's really clear advice for a specific group, but what about the rest of us? How can someone listening know if they're one of those sensitive people without going to a lab?
You can actually test it yourself pretty easily at home if you have a blood pressure cuff.
Oh, really? How?
It's simple. Step 1, wake up. And this is the hard part for you, Emily. Do not drink your coffee.
Ugh, the ultimate test of willpower.
Just for a bit. Sit quietly for 5 minutes, no scrolling on your phone, and take a reading. That's your baseline.
Okay, I can do that. Then drink the coffee.
Then drink your normal morning coffee, wait about 30 to 60 minutes, then sit down, relax, and take your blood pressure again.
And what am I looking for?
If it's gone up by 5 to 10 points or more, then you are, by definition, sensitive to the blood pressure-raising effects of coffee.
And if it has, does that mean I have to quit?
Not necessarily. If you start at 110 and go to 118, that's not a concern.
Mm-hmm.
But if your baseline is 135 and you jump to 145, then yeah, you might want to consider cutting back or maybe switching to half-calf.
Is there a generally agreed upon safe limit for daily intake?
For most healthy adults, the FDA and other health organizations recommend capping it at 400 milligrams of caffeine per day.
And in real-world terms, what is that?
It's about 4 standard 8-ounce cups of brewed coffee. And that's key 8 ounces. If your favorite mug is 20 ounces.
Then that's 2.5 cups right there. Guilty. My mug is basically a soup bowl.
We all do it. But before we wrap up, there's one more really important point I want to make. It's a more holistic view.
Days.
Sometimes a patient's high coffee intake isn't the cause of their high blood pressure. It's a symptom of the real cause.
How do you mean?
I'll ask them, why are you drinking 5 cups of coffee a day? And the answer is usually because I only slept for 5 hours, or because I'm so stressed at work I can't function.
The coffee is just a clutch.
Exactly. And we know that chronic stress and poor sleep are massive drivers of hypertension. The coffee is just the Band-Aid you're using to mask the real problem.
That's such a great point. We focus on the coffee as the villain when it's really just the accomplice to a lifestyle that's doing the real damage.
Precisely. So before you blame your latte, maybe look at your sleep schedule or your stress levels first.
Okay, let's try to recap the big takeaways here.
Let's do it.
First, coffee does cause a temporary blood pressure spike, especially if you're not a regular drinker. It's the kink in the hose effect.
Correct. But second, if you are a regular drinker, your body builds a tolerance, and that spike gets much smaller or even disappears.
Right. And third, it's not just about the caffeine. The espresso study showed us that other compounds in the coffee bean play a role, since even decaf had an effect.
And fourth, the big one. The real danger zone is for people with severe hypertension, 160 over 100 or higher. For them, 2 or more cups a day is a serious risk.
But for everyone else, under 400 milligrams a day is generally considered safe.
You got it.
Stephen, this has been so incredibly helpful. I feel so much better about my morning ritual now.
Good. And I want to leave everyone with one final thought, going back to that decaf finding.
Go for it.
We spend so much time trying to isolate the bad molecule, in this case caffeine. But that study proves we consume whole foods, not just single chemicals. But maybe more importantly, if you're sitting there stressing out, worrying about whether your morning coffee is bad for you, that stress and anxiety is probably raising your blood pressure more than the coffee ever could.
The stress is the real vasoconstrictor.
It absolutely is. Sometimes the healthiest thing you can do is just relax and enjoy the cup of coffee.
I love that. Dr. Stephen, thank you so much for clearing all this up for us.
My pleasure, Emily.
And thank you all for listening to the Healthy Talks channel. We'll see you on the next Deep Dive.